Dr. Death, Christopher Duntsch. It is not often that medical malpractice becomes a mainstream story, but that is exactly what happened to Texas neurosurgeon Christopher Duntsch, Dr. Death. News articles, a dedicated Wikipedia page, a popular podcast, and coming the fall of 2021, a new television series tell the story of Dr. Death and his patients. The story has all the elements of a lurid bestseller, a seemingly talented and ambitious young physician, several positions with a series of respected institutions, allegations of drug use and extramarital sex, and high-risk surgical procedures. There are numerous guardrails designed to ensure medical professionalism and patient safety, including the American Medical Association Code of Ethics for self-policing, laws such as the Health Care Quality Improvement Act that require reporting of medical disciplinary actions and provide immunity for participants in professional peer review activities, as well as state medical boards that investigate allegations of physician incompetence. Yet, Dr. Duntsch somehow was able to gain privileges at hospital after hospital and continue to operate on patients despite multiple bad and sometimes fatal outcomes. Don't forget to like and subscribe to our channel for future interesting videos. Identifying a potential problem begins at the beginning. The ability and obligation to identify a potentially troublesome candidate starts at the beginning of the path to becoming a physician. While grades are one reflection of a student physician's professional ability, they are not a replacement for the honest evaluation of professors and physicians who teach and observe the student. During residency, attending physicians work alongside student physicians and oversee their performance. Ultimately, residency directors have the very important duty of honestly evaluating the skill and competency of a student physician before releasing them to care for patients independently. The Missouri Occupations and Professions Code, and specifically the statutes related to the healing arts, define unprofessional conduct as, among other things, any conduct or practice which is or might be harmful or dangerous to the mental or physical health of a patient or the public, or incompetency, gross negligence or repeated negligence in the performance of the functions. Principles of ethics as a self-policing tool. The AMA Code of Ethics is exactly as it sounds, a set of ethics rules that physicians commit themselves to follow upon entering the medical profession. By becoming a physician, each member is bound by these standards, which should serve as a self-policing tool for the practice of medicine. The first principle of the AMA Principles of Medical Ethics 5 states, physicians shall be dedicated to providing competent medical care, with compassion and respect for human dignity and rights. The second principle provides that physicians shall uphold the standards of professionalism, be honest in all professional interactions, and strive to report physicians deficient in character or competence, or engaging in fraud or deception, to appropriate entities. In theory, these principles not only require physicians to provide competent and compassionate care, but they also impose an obligation to report other physicians who fail to meet this requirement. Yet, self-regulation does not always work. Hospitals and physicians with collegial relationships fail to report other doctors. Despite the warning signs, a 2007 survey of 1,662 physicians is illustrative. While 96% of the responding physicians agreed they should report impaired or incompetent colleagues, only 45% of respondents who encountered such colleagues had reported them 9. There may be various reasons why self-policing among colleagues has not worked. As a general business model, physicians rely on each other for specialty referrals, and some physicians may be hesitant to tell on their peers' fear of professional retaliation or legal liability has also been cited as a reason for staying silent, as any issues raised may lead to retribution in the form of peer reviews initiated to get back at the doctor who has spoken up, or even a lawsuit. 11 Silence fosters more silence when role models, mentors, and colleagues incubate a culture of not reporting concerns. Junior physicians who realize this cultural expectation will be less apt to report their concerns to their supervisors. In one example, albeit an extreme one, physicians performed makeup or clean-up surgeries after a surgeon botched one procedure after another. Remaining faithful to the obligations cast upon physicians by the AMA Code of Ethics is critical in protecting patient safety. Physicians possess the unique experience and expertise to recognize issues in a colleague's performance. In fact, physician peers may be the only ones who can recognize incompetence, or, in the case of surgeries, nuanced problems in technique. Accordingly, the second step in identifying a potentially bad physician is the role that physician peers play. A culture in which physicians feel safe and empowered to report problematic colleagues to their employer, the licensing board, etc., will support patient safety and mitigate against the possibility of another doctor death. Employer responsibilities. The National Practitioner Data Bank, NPDB, is a databank of medical malpractice payments and certain adverse actions related to physicians and other healthcare providers. The NPDB was established by Congress in 1986 as part of in order to improve the quality of healthcare, protect the public, and reduce healthcare fraud. Whenever a healthcare provider applies for employment, hospitals and employers search the NPDB to determine whether any adverse actions or malpractice payments were reported as to that provider. In theory, a quick search of the NPDB should be able to identify whether a particular physician may be problematic. However, in practice, healthcare entities, like hospitals that have a legal obligation to make the report, do not always discipline their physicians such that it becomes reportable to the NPDB. In fact, an investigative piece by a Texas television station found that 2 out of 3 Texas hospitals had never reported a bad doctor to the National Practitioner Data Bank, NPDB. 14. Given the universal concerns about the potential impact on a physician's career, the Texas statistic may not be unique to Texas. In Missouri, the St. Louis Post-Dispatch found that from 2004 through 2008, Missouri's 140 hospitals reported only 41 actions against 32 doctors, or a little more than 8 a year. The same article also cited to a statement by the former director of the Missouri Board of Registration for the Healing Arts as saying that the board may never hear about some doctors because a hospital may try to salvage a doctor through internal rehabilitation. Outside of the NPDB framework, healthcare providers rely on the reporting of other providers through the credentialing process to determine whether a particular physician should be granted privileges to practice at a facility. However, not all references from past employers or affiliated providers can be relied upon. For example, in Cadlet Medical Center v. Lakeview Anesthesia Associates, Dr. Berry was terminated by his anesthesia group and had his medical staff privileges revoked at Lakeview Medical Center for substance abuse. 16. Neither his anesthesia group nor Lakeview reported Dr. Berry's impairment or terminations to the Louisiana Board of Medical Examiners or to the NPDB. If you enjoyed from this video, don't forget to like and subscribe to our channel for more content. Thanks for watching.